Hi, this is Dr. Mercer, and I've prepared a short audio vignette, if you will, regarding ADHD, pharmacotherapy, some advantages, disadvantages, and clinical pearls, which you may or may not get in your reading materials. Some of this you definitely will, so it'll be a bit of a review, but just some of the things that I wanted to highlight that I think are important. First of all, as many of you know, and if you don't need to know, that of course the stimulant medications are Schedule II drugs. So in the state of Texas today, as nurse practitioners, we cannot prescribe these. Only the physician can prescribe Schedule II drugs. And so first I want to talk a little bit about short-acting stimulant preparations. Although we can't prescribe them, we definitely need to have some good working knowledge about these medications, because oftentimes it is the nurse practitioner that does see this patient initially and does the workup, and it is extremely important that we understand the medications that the patient may need to be taking or has already been taking when we are collaborating with that psychiatrist. So let's talk about short-acting stimulant preparations. Advantages: the stimulant medications, these stimulant medications have an extensive database really supporting their safety, efficacy, and of course the short-acting have a rapid onset of action and really only last a few hours with most patients. You know, individuals, there'll be some that may say it lasts an hour longer than maybe the other patient that you just gave it to, but for the most part, they're having to dose these medications 2 and 3 times a day. So you'll hear patients say, I feel like I was, able to read and concentrate and get my work done or my schoolwork done, and then all of a sudden it's like, oh my goodness, I can't focus anymore, and they're digging through their purse or their desk looking for another dose to take of the short acting because it's simply worn off. So they'll tell you they kind of feel that up and down feeling all day, which many patients do not like at all. And there's also some studies out there that suggest that there's more of an abuse potential when using a short-acting stimulant rather than a long-acting stimulant. So a couple of things that I wanted to say about that is when you see children that this medication is being prescribed to, extremely important to monitor growth, height, weight. These medications have a propensity to, especially in children, decrease appetite and sometimes can cause some insomnia. So really important that you always question them about appetite, sleep, and get the height and weight. We also know that stimulant medications also have the potential to increase one's heart rate as well as one's blood pressure. And whether you're prescribing for a child, or I should say whether your psychiatrist is prescribing for a child or an adult, remember prior to he or she ever prescribing, it's extremely important to get a very thorough cardiac history, not only of that patient, such as chest pains, fainting, palpitations, exercise intolerance, but a family history. So immediate family members, is there any history of premature coronary artery disease, heart attacks, sudden death? Those are all extremely important, as well as any kind of structural heart defects, such as an enlarged heart or any kind of congenital cardiac problems. And when in doubt, obviously refer to cardiology. And it's not a bad idea to get an EKG on everyone prior to starting these medications. In the practice where I work, we sort of use 40 years as our cut point for making sure that a patient has a cardiac clearance prior to our psychiatrist ever prescribing any stimulant medications. So every practice is different, but always better to err on the side of caution and know the importance of getting that history. When we talk about Short-acting stimulants, sometimes we have to use those initially with children, particularly ones that don't weigh a whole lot and still need some. So anybody less than 16 kilos that is needing that treatment, when the psychiatrist prescribes for them, short-acting stimulants is what they would need to use. And also for short-acting medication to be used, can be useful rather, as an additional treatment in conjunction sometimes with a long-acting one. We see that often with, I'll talk about college students, for example. They will, sometimes if they have day classes, early morning classes, and they may have an evening class. So we may prescribe, a long-acting stimulant medication that the patient takes in the morning, which then begins to wear off sometimes around 5 o'clock, and then it's time for that evening class. So oftentimes the psychiatrist I work for will go ahead and prescribe a short-acting stimulant preparation in addition to that, to kind of give them that little boost to get through that evening class. And sometimes you'll see that done with children, because by the time they get home it's pretty much worn off. They still have to get their homework done, and so a short-acting will be given just to kind of get them through that. For a minute, I want to talk a few minutes about long-acting preparations. So the longer-acting stimulants, such as Adderall XR or Vyvanse, those are a couple that I can think of off the top of my head, are certainly as efficacious as the short-acting stimulants and provide a longer effective response that limits the need for multiple dosings. It's just as patients will tell me, just a quote, longer, smoother ride throughout the day, end quote. And so also, we think probably less of an abuse potential, because they really don't feel that pulsing of I'm up, I'm down, I'm up, I'm down, as they do with the short-acting that has to be dosed multiple times of the day. So some of the disadvantages, though, I guess the biggest would be for a long-acting is, well, if you have a side effect, you're just going to have to ride that out too. And so the longer the duration of the action, if side effects emerge, they can extend a little later during the day. Remember, too, that the new terminology, which you'll see on boards, of course, is ADHD, inattentive, which is most adults, ADHD, hyperactive, and ADHD combined. So you'll still have patients come in and talk about their ADD, but you know what they're talking about. That's just the new verbiage, but need to be familiar with that. Another thing I want to just remind everyone is, I'll have patients many times say, but do I have to take this every single day? No, you don't. You're not going to have withdrawal symptoms. It's perfectly fine. If you have classes on Monday, Wednesday, Friday, and that's the only days that you want to take it, do that. If you don't want to take it on the weekend, don't take it on the weekend. And many times children over the summer or holidays will take a drug holiday, and especially when they're underweight and the parents are worried about their eating habits. If school's out, many times they'll take them off the medication with the psychiatrist approval, and let them eat more and try to build that weight back up before school starts, and they have to go back on the medication. There are some non-stimulant preparations out there. Strattera is probably one of the main ones. I use that quite a bit. That is something we can, as nurse practitioners, prescribe. It's not controlled, and I really think it's probably a pretty decent drug. I will use that a lot of times if there is a reason a patient cannot take a stimulant, has not been cleared by cardiology because of a history of some sort of, cardiac issue. Also, if the patient simply does not want to take a stimulant, and you'll have patients like that. And so, like I said, the Strattera medication is really a pretty decent drug in my opinion. I have pretty good success with it, particularly if I can get that out, when the patients have not taken stimulant medications in the past. Now, if they have, they may frequently tell me, I don't think this medication's working. Well, they don't think it's working because they don't get that feeling when the stimulant medications would give them when they kicked in. So if you ask them that, well, why do you think it's not working? Well, I don't get that same feeling when the Adderall used to kick in, or the Ritalin or whatever. And so I always have to try to bring them around and say, well, it's not really the feeling that we're after. It's the idea of whether you can concentrate and focus better and stay on task. And so try to reframe it that way. And so most of the time when I do that, then they kind of sit back and think about it, and they say, well, I guess you're right. It does a pretty decent job. So not a bad medication, and certainly an option. You will read some literature that suggests the use of Wellbutrin. I have personally never seen that work. I would probably, if I had to do a non-stimulant, pick Strattera over that any day, if that's what I was trying to do, is help focus and attention. So anyways, those are some of the practice pearls that I wanted to share with you all, and I hope that helps. Thank you very much.